like turning around. Oh, we're live. So we are live, and I do have to check. I'm going to let you do the intro while I go and check to make sure that we're public, because I have a little issue with that with this new platform that we're using. I go live and it's not public, so it's not displaying, and I have to change it. So you do our intro while I go look. I look like I'm being rude.
All right, Jannis. Hey, welcome everybody. I'm Dr. John Rothwell, Advanced Practice Registered Nurse with Island Direct Primary Care. And I've been so blessed to be invited here to speak with Ms. Jannis Paulk, the CEO and President of Clarity-Based Marketing. So thank you, Jannis, for having me. And I'm looking forward to continuing our Outside the Box 2020 now that we're into our third month of the new year. So thanks for having me.
Yes, thank you for being here. And I still haven't changed. I said I was going to change that to Outside the Box 20/20, like 2020 vision, which I still don't have, but I'm getting better. I'm getting there. I'm getting closer. So there's that. And I checked, and it was private. So I'm not sure. You know, we're using this new platform, StreamYard, and I really love it. One of the things that I love about it is that people can actually post comments, and we can see them and address them. So if you are here and you want to talk to us, you can talk to us, and we can answer your questions live. So I'm just checking, and we can also stream in multiple locations at one time. And so I'm super excited. Today, you didn't know this, but today we're streaming live on YouTube, on my personal profile, and on the Clarity-Based Marketing page. So how about that? Right?
Woohoo!
Like, we're fancy.
We're fancy. I'm glad I got my AirPods working today.
Me too. Me too. I'm quite impressed. I'm quite impressed with you. So today we're going to talk about oh, look at you. See, I'm going to get myself set up. You know, I just moved recently. We talked about that the last time we talked. I just moved, and I'm going to get myself all set up. So all I have to do is like click a button and I'm ready. Today I'm using like my old raggedy webcam. So anyway, we won't talk about that. So if you're watching, you can comment and ask questions or talk to us, and we can speak to you directly. We have one person who's watching live. That's great. Thank you for being here. Today we're going to talk about COVID controversy, and Jannis is probably going to get a little emotional about that, because I have a COVID controversy, firsthand COVID controversy in my life, and I want to talk about it because there are some things that happened this week that really have me unsettled. And so for those who don't know, my stepmother passed away February 5th after an extended illness. Well, not really an illness. She had surgery. I'm going to give you a quick little overview of what happened. So she had surgery on December 8th on her spine. She had a fractured vertebrae and was in a lot of pain. But that was her only health issue, is that she had pain from a fractured vertebrae. December 8th. December 22nd, she had infection at the site of the surgery, the incision. It was infected, and it just went downhill from there. You know, the infection just got worse and worse. She saw the surgeon. They gave her antibiotics. It was just not good. It was not good. But the infection was the source of the issue. She was admitted to Holmes Regional Medical Center on January 8th. And she was septic at that time. She was there for 10 days. They sent her home on January 19th, septic. And on January 20th, she was admitted to Palm Bay Hospital, septic. It was a disaster. I thought she had a stroke. I mean, it was just infection. On January 31st, she was diagnosed with COVID, which she contracted in the hospital, obviously. And they sent her home in hospice care. And the diagnosis, the hospice diagnosis, I saw it with my own eyes. The hospice nurse showed it to me, was, and correct me if I'm saying this wrong, Dr. John, osteomyelitis. Am I saying that right? Mm-hmm. Osteomyelitis of the lumbar region. And the hospice nurse explained to me that the hospice primary diagnosis was systemic infection from the surgery. Okay. She came home on Monday evening or Tuesday, and she passed on Friday. And we talked about getting a private autopsy because I was concerned that they were going to attribute her death to COVID. And I talked to the medical examiner, and he said, no, you know, we'll look at everything. And sorry about that dinging. My phone is dinging. We're going to look at everything, but, you know, her primary diagnosis was, you know, systemic infection from the surgery. And, you know, this had been going on, and, you know, it'll be fine. So we opted not to do a private autopsy because consequently that autopsy was going to cost $5,000 or $6,000. And that was just because we were, you know, upset about what happened. She shouldn't have died. The bottom line is she shouldn't have died. And so this week we got the cause of death, death certificate. We needed it for some paperwork that we were filing. So we had not had it. And on Monday I saw it. And the cause of death, the primary cause of death, is COVID. So in case you couldn't tell from Jannis's little like head nod, Jannis not happy about that. That's crap. It's not true. She didn't die from COVID. So, Dr. John, I don't understand. I don't understand. You know, and I've been seeing that, and you're so quiet. You're so quiet. Anybody who watches us is like, oh, Dr. John is quiet today because Jannis is mouthy. But I'm just so frustrated about it. And, you know, we've heard people saying that the COVID deaths are inflated because they are attributing deaths to COVID that shouldn't be. And I'm not a big controversy kind of person. Like, I don't like to feed the flames of controversy unless I'm absolutely certain that it needs to be fed. And in this case, I'm just going to tell you, I'm having a really hard time with it. I really am. And I'm not sure. I'm just not sure how to feel about that. You know, I don't know. Okay. Talk to me. Talk to me.
You know, it's interesting. Our dialogue is usually full of a little bit of banter and fact and stuff going back and forth. And you're right. I'm quiet.
You are, and Jannis is upset today. And I'm not usually.
And I'm quiet. And the reason for it is, I mean, you know, look, it's no secret that you know, I'm your primary care provider. And so, and you know how I feel that everybody deserves to be heard, so that you're not overwhelmed and so that you're not frustrated. And so I kind of went into more of the therapeutic role, if you will, and just sat and just kind of listened. There's a lot of questions in this scenario, that in the case that you provided, if you will, with your stepmother, and you know, not knowing the full past medical history and going down that rabbit hole. I think in most cases that's just really immaterial. I think the point here is John, she went in, she was diagnosed, she was admitted for that diagnosis, she was discharged with the diagnosis, and then when she died, she was given a different diagnosis. And why? And so I'm not the medical examiner, so I really can't speak on their behalf.
I know.
What I can say is that you made a comment at the end about, COVID controversy and how people are, you're not the first person I know, nor my first patient, by the way, who has had a family member pass during the pandemic time and was given the diagnosis of COVID when it wasn't COVID. Some could argue this. You made a comment that your stepmother should not have died. Outside of the back pain in which she had surgery, in which she had infection, which she ended up with the systemic infection, i.e. sepsis.
Yes.
And sepsis, by the way, complications from sepsis can kill you. And so they present very much like you were saying, like a stroke. I can tell you my ER, my time in the emergency room, women would come in, like they're having a stroke and they're, 70 years old, 75 years old, and they have a UTI.
Yep. And that's what she had on January 20th when she went to the hospital the last time.
Yeah. And so, that's urosepsis. And so, so you throw a major virus on this, right? A serious virus on this. One could probably argue that the complications of COVID made treatment for the sepsis much more difficult.
Absolutely.
Both actually cause multi-system organ failure. Do you know what I mean by that? I
do.
So
I'm a doctor. But I do know what that is. Everybody else may not know. You can explain what it is.
Multi-system organ failure at a 30,000-foot view is we have lots of body organs and they all have specific jobs to do. And as sometimes when you get sick, one organ stops working properly and it shuts down. And while it's shutting down, another organ tries to pick up the job, but then it's overworked and then it shuts down and there's this cascade effect or a domino effect. And so oftentimes it starts with the kidneys, right? And so the kidneys stop shutting down and they stop filtering and then your body becomes more toxic. Your liver is what helps break down that toxicness, if you will. And so then the liver starts to shut down and then everything goes to the heart and the brain and eventually those stop, And
I believe that that's what happened. When they diagnosed her that Sunday, she passed on a Friday. On Sunday, when they said, oh, she's COVID positive, I knew in my heart that she was not going to be able to beat the infection because her body was now weakened by the COVID infection. And so I knew, when they said that, but that doesn't change the facts that she got COVID because she had a systemic infection from surgery and from a wound that wasn't properly taken care of, which that's another whole rabbit hole. But COVID is not what killed her. COVID is not why she died. She died because she wasn't properly taken care of, and she got an infection that wasn't properly taken care of, and then she got COVID in a high-risk environment, and it just really upsets me. And what upsets me most of all is that I specifically spoke to the medical examiner prior to them determining the cause of death and told him I was concerned that he was going to decide that COVID was the cause of death, and COVID was not the cause of death, and that they sent her home with a primary diagnosis of systemic infection from the surgery. And it wasn't even, so there were three actually. There were three things listed as, cause of death. First was COVID. Second was coronary artery disease. And third was the systemic infection. And they had that flipped, in my opinion. First should have been set what?
Say those three again.
First was COVID. Second was coronary artery disease. Third was systemic infection. All three of those were listed. But it said primary was COVID. Secondary was coronary artery disease. And the third was the systemic infection. And that's in my opinion, based on what I know and what I saw and the experience that we had, the primary reason that she died was the systemic infection. The secondary reason was her coronary artery disease. And the third, the final thing was COVID. Makes me want to choke somebody.
Yeah, so I can see why you would think this way. It's not quite how it works. Okay.
I'm open to hearing.
So again, I mentioned the multi-system organ failure.
Yes.
So someone gets a systematic infection. Mm-hmm. So, and they're young and healthy, and the infection doesn't reach their heart. They have a healthy heart. Then, they heal fine, right? They're able to overcome the infection. Someone who has coronary artery disease has a harder time fighting that infection.
Okay.
So is the reason because of the infection, or is the reason because of the coronary artery disease? And so there could be an argument to say that the person already had coronary artery disease. This was a chronic piece, and the systemic infection made it worse, but it was the coronary artery disease. In other words, she had a heart attack in layman's terms. Sure. Her heart stopped because of the pressure it was receiving from trying to fight the infection.
Okay.
So the primary cause wouldn't be the infection. The primary cause would be the coronary artery disease, right? So COVID is an interesting, I want to say it's an interesting animal, but it's not an animal at all.
I don't know if interesting is quite the word I want to use.
Well, it's interesting because even with all its uncertainty, mm-hmm. there is a tremendous amount of unknowns.
Okay, fair enough.
And there's a tremendous amount of hypothesis. And then there's some facts, right? And so the facts are that we're not all the same. And so some people who have COVID, their blood responds differently. Their blood tends to clot. They tend to have emboli or embolism, like a pulmonary embolism, a lung. They tend to have strokes. Okay. Mm-hmm. So is it the stroke that killed them, or is it the COVID that killed them? You could argue both ways. I think the most appropriate way to really say it is like, look, the chances, if I looked at, I go see my doctor for me, I like to see everybody at least twice a year, if not more, right? Because I think healthcare is more than sick care. So if I look at risk factors, and if your risk factors for stroke is less than 5%, less than 1%, then you get COVID and you end up having a stroke. Is it because the complications of COVID, or because you had cerebral artery disease, right? It's not because you had cerebral artery disease. It's not because you had coronary disease. It's because of COVID, right? That being said, if you have all the risk factors and you have chronic illnesses already, and then the COVID kind of causes an exacerbation of those chronic illnesses, then
I get that.
That's a little different. So I think the medical community, and again, I mean, I want to say I'm not talking for them, but I guess in a way I am, because I'm the medical guy, right? We all have different qualifications, so I may not be qualified to make this statement, but I'm going to make it. And that is, I don't think we're right by saying the members of our community are dying from COVID, when in all actuality, it's more of a complication from COVID. Yes. And so why can't we write complication of COVID? And it's interesting. I don't know if you've ever signed a death certificate or how many you've read, but government, you're familiar with government paperwork, though, aren't you?
Yeah. Yes.
Right. And so government paperwork, healthcare paper, insurance, you know how I feel about health insurance. Their paperwork requires specific verbiage on how things are done. And so as a healthcare provider, you tend to work within the system, the verbiage. Mm-hmm. So
it's still just, I still am just so annoyed. I'm just so annoyed about the situation. And, and it's not like me, I don't normally get like this, but I just, I talked to a friend of mine about it this morning, and she said that she had a friend who I think their father passed away, and they listed the primary cause of death as COVID, and they fought it. They said, no, that is not why. And I don't remember why he passed away, but they fought it, and they actually changed it on the death certificate. And then, and I know that I know somebody who knows somebody kind of thing. And that's how this has all been for me up until this point. The controversy surrounding some of this has not touched me personally. This has touched me personally. So that's why I am so animated about it right now, because, I don't usually go down rabbit holes that I didn't dig. So, I know somebody who knows somebody who, died in a motorcycle accident, who happened to be sick with COVID at the time of the motorcycle accident. And they listed COVID as the cause of death, and they went back and fought it and, and changed it, because that's about as clear as it can be. Somebody has an accident and they die. Clearly, I don't care if they had COVID when they died or not. That wasn't why they died. So it's not as cut and dried in this case, and for all of the reasons that you stated. I understand that. I do. I understand it. But at the end of the day, the bottom line is that she would not have died. I believe in my heart of hearts, she would not have died if she had not had infection from that stupid surgery. And, my dad got COVID too. My dad will be 85 next year. And he got COVID after spending 2 months with her as her primary caregiver, taking care of her. He spent the last, from January 20th until February 1st, physically in the hospital with her 24/7, because I got a variance for him to be able to stay there with her and not have to go home. And he was physically there. So the reason I say that, he was so tired, so worn out. He wasn't eating, he wasn't sleeping. He was, so strung out, almost 85 years old. He got COVID from her. And he's fine. I was terrified. I thought it was going to kill him, and it didn't.
Yeah, that's unfortunately that's not a really good comparison, right?
It is. Yes, it
It
is.
isn't.
It is too.
It is. You know, I mean, let's take me for example.
Anyway, we don't have to go down that. I get it. I'm just angry.
So that brings me to this. You're grieving.
True.
And anger is part of that process.
True.
And I am so grateful that you're going through the process and that you're speaking about it. You're talking to your friends. I met one of your accountability partners. I hope you're talking to her.
Yeah.
And so this is good. And so it's part of the healing process.
True.
And it's okay to question and it's okay to ask. What's not okay is to hold it in. What's not okay is to keep it to yourself and not talk to your loved ones about it. Before the pandemic, mental health was of epidemic proportions. And with the pandemic, some would argue it's of a pandemic proportions now. And so that happens because we tend to hold things in. We tend to try to deal with them ourselves, and we don't talk to people, and we don't listen to people. I've experienced suicide in my own family during this pandemic, and it's I'm experiencing death right now. My dad's going through the dying process as we speak. Okay, and it's but it's part of the process. It's, life is a process. I tell my family, I go, don't mistake my lack of emotion at the moment for indifference. I'm actually quite empathetic, but right now my role in the family is different. Excuse me. My role is to be that medical guy, to be the guy that everybody can come to for questions, to be that guy to talk about physical, mental, emotional, and spiritual wellness, right? And financial, that's part of it too, right? And so someone has to do that right now.
True.
I have my accountability partners too. Those are the guys that I cry with. Mm-hmm. My spouse, I cry with her, but then on the outside, it's different.
Bless you. Well, I'm kind of proud of myself for not crying during this one, because it is, you're right. It's, it's part of the grief process, and it's hard, but I do think that they've skewed the numbers by this, but after talking to you, I'm glad that we did talk about it, because I hadn't really thought as deep as, some of the things that you said. Like, it does become difficult. I can see from a medical professional standpoint how, those three things, definitely all three of those things came into play in, that resulted in her death. And how you list those things, I guess, can be convoluted when it comes down, the medical examiner and his job and how that's done. And like you said, with, government paperwork and, how things are done and coded and, all that. So I get it. And it's not something that I am dwelling on. Although I will say this, I do intend to help my dad tell her story, because her story is tragic, and it absolutely is a gross display of what should not happen in a healthcare journey. It is the absolute worst possible outcome. She should not be dead. She should be right here with us right now. And I'm going to help tell her story And how I'm going to do that, I'm not sure yet. But we have talked long enough. We're right at 30 minutes. So this new platform we have, I'm so disappointed nobody has commented yet, and I'm not sure if that's because it's not working properly. The next time we talk, I'm going to have to get somebody, I'm going to have to ask somebody to specifically log in and comment so we can make sure it's working properly. I thought about that today. So anyway, thank you so much, as always, for being here. Thank you for allowing me to get a little snippy about a controversial subject, and hopefully it was a worthwhile discussion for whoever's watching. And you, my thoughts are with you and your family while you go through this with your dad. I'm sorry.
Thank you.
Absolutely. And you have a wonderful afternoon. Thanks always for being my person, my healthcare partner. Thank you. Thanks for being here. If you're watching, if you have any questions or you want to chime in, you know, Dr. John is really, really good about following up and looking at those comments and answering when you can. And join us next week. We should be here on Wednesday, and talk to us and we'll talk back. Awesome. So bye, everybody.
Thanks, everybody.